all the oxygen you can from that blood. Therefore, because you extract almost all the oxygen, you have a very low venous PO2 then in the coronary circulation. And a very good standard question would be the following. Under resting conditions, where do you find the lowest PO2 in the entire cardiovascular system? The lowest PO2 under resting conditions is always found in the coronary sinus. The answer is coronary sinus because under resting conditions, you extract almost all the oxygen you can from that blood as it passes through the myocardium. Now, because of that point, you should also realize that in the myocardium, flow must match metabolism. In other words, because you cannot increase extraction, an increase in metabolism must be accomplished by an equivalent increase in flow. In the myocardium, flow should always match metabolism. Now, there's another standard question about this point. The standard question is, if myocardial metabolism doubles, what is going to happen to coronary flow? And the answer is, it must double. Because extraction stays the same, if you double metabolism, flow must also double. And that is an important point. Now, finally here, and I don't know if step 1 tests this very often, I consider this very important to understand. That is, total coronary flow. We're not talking about regional flow here. Total coronary flow then is determined mainly by the pumping action of the heart. Total coronary flow is determined mainly by the pumping action of the heart. It is possible they could give you various situations, and they would want you to know what happens to total coronary flow in a particular situation. All you have to say to yourself is, what happens to pump function? If you have an increase in pump function, then you must have an increased coronary flow because metabolism increases. Now, we put down a couple of situations where you have increased pump function. One is exercise. When you exercise, blood pressure does not change, but cardiac output increases. And therefore, during exercise, we have something called an increased volume work of the heart. You're pumping more volume at approximately the same pressure. But because work increases, total coronary flow has to increase. Another situation is increased arterial pressure or hypertension. With hypertension, you are pumping blood against a higher pressure. You're pumping approximately the same blood, but against a higher pressure, and therefore you're doing more work. And this is referred to as an increase in pressure work. And therefore, coronary flow has to increase. You must understand that hypertensive individuals will have a higher coronary flow than a normal tensive individual. The heart is working harder to pump that blood, and it requires more coronary flow then. And as I said, I think that's a very important point to understand. Now, the next circulation we'll take a look at is the cerebral circulation. And of all the systemic circuits, in terms of what controls flow, this is probably the heaviest tested circulation on step 1. And the big point in this circulation is the flow here is normally proportional to arterial PCO2, not venous PCO2. The circulation is responding to arterial PCO2. This CO2 is probably the vasodilatory metabolite that is regulating flow here. Now, because this is a very important point, we put in a couple of specific situations. Suppose you hypoventilate. If you hypoventilate, then you will always get an increase in arterial PCO2, and this will always cause an increase in cerebral blood flow. The increased CO2 is causing the increased flow. More importantly, if you hyperventilate them, the hyperventilation will decrease arterial PCO2. Therefore, you are withdrawing a vasodilatory metabolite, and that would cause a constriction of the cerebral vessels. Now, a lot of you probably know if you want to almost instantly decrease cerebral blood flow to a patient on a ventilator, all you have to do is turn up the ventilator. If you turn up the ventilator, you'll be hyperventilating that patient. You will have blown off some CO2, and you will almost immediately get at least a transient constriction. So hyperventilation will always cause at least a transient vasoconstriction of the cerebral vessels. Very important point to remember. Now, PO2 is more difficult to deal with, and being very careful here. If the arterial, and again it's responding mainly to arterial, if the arterial PO2 is normal or elevated, this will not affect cerebral blood flow because cerebral blood flow is regulating mainly via CO2. So under normal conditions then, PO2 does not affect cerebral blood flow. Just to underscore that point, if you have a normal person breathing room air and that person is switched to breathing 100% oxygen, that will raise the arterial PO2, but it will not change cerebral blood flow. Because whether the PO2 is normal or elevated, it is the CO2 that system is responding to. However, if we look at an abnormal situation, suppose the arterial PO2 has a large decrease. If there is a large decrease in the arterial PO2, that PO2 will always increase flow, regardless of the CO2. So a large decrease in arterial PO2 will always cause a vasodilation and an increase in cerebral blood flow. Now finally here, you should realize the baroreceptor reflexes do not affect flow here because this is a message coming from outside the tissue, and the cerebral vessels always totally auto-regulate as far as we are concerned. Now the next circulation to take a look at is the cutaneous circulation. Now we're really going to the opposite end of the spectrum here. In the cutaneous circulation, we have basically no autoregulation. Almost all the regulation is via extrinsic mechanisms. Now this circulation is very unique. Now there are three important points that are fairly unique to this circulation. First of all, this circulation is almost entirely controlled by sympathetic adrenergic nerves. Now physiologically, it is totally controlled by sympathetic adrenergic nerves releasing norepinephrine acting in alpha receptors. Physiologically, beta-2 receptors do not exist in the circulation. However, you can demonstrate their presence pharmacologically. So in normal physiological circulations, beta-2 receptors do not contribute to cutaneous blood flow but you can demonstrate their presence if you give a high enough dose of an agonist to these receptors. Now, this circulation is very unique in that you have a large venous plexus that is heavily innervated by sympathetics. Now, I know veins are innervated by sympathetic neurons, but the venous plexus in the cutaneous circulation is very heavily innervated via sympathetics. Fairly unique situation. And finally here, we have AV shunts that are also innervated by sympathetics. Again, it will be sympathetic adrenergic nerves releasing norepinephrine acting at alpha receptors. Now, a standard question on step 1 is to ask you the consequences of sympathetic stimulation to the skin. And you should realize that sympathetic stimulation to the skin will cause the following. First of all, you will get a constriction of the arterioles and a decrease in blood flow. Secondly, you will get a constriction of the venous plexus and a decrease in blood volume in the skin. Now, most of the volume of the blood in the cutaneous circulation is in the venous plexus. And it is this volume that is exchanging heat with the environment. Therefore, if you constrict the venous plexus, there's less volume there to exchange heat with the environment. And finally here, sympathetic stimulation will increase the velocity in the cutaneous circulation. And remember, this is speed. So speed increases because there is a decrease in cross-sectional area. Now, this also relates to heat exchange, because if you increase the speed through the cutaneous circulation, there's less time to exchange heat with the environment then, and that is an important consequence. Most of the questions on step 1 will involve your understanding that blood flow in the cutaneous circulation is mainly related to heat exchange with the environment. They could even ask you if a person in a warm room wearing a short sleeve shirt goes outside into a colder environment, the cutaneous circulation should constrict because you need to conserve heat. The bottom line is, if you need to conserve heat, then you constrict. If you want to dissipate heat, you dilate. Now, the best questions here would involve fever. Now, with a fever, you have to realize you simply have a change in set point. You do not lose the ability to autoregulate during a fever. So when you develop a fever then, you have an increase in the set point. Your set point is normally 37 degrees. If you develop a fever, your set point increases. And therefore, you employ mechanisms to raise body temperature to this higher new set point. This would include a vasoconstriction of the cutaneous bed and shivering to generate more heat. Once you reach that new set point, you simply regulate around that set point. Now, when a fever breaks, and the word break means the set point has suddenly returned to normal. Now, if your set point returns to normal, then the body temperature is above that set point. So what would you want to do? You want to vasodilate the cutaneous circulation to dissipate heat, and sweating will also promote the dissipation of heat. The bottom line point for this is, during a fever, you do not lose the ability to regulate body temperature. You simply regulate at a higher set point. If you want to conserve heat, you constrict the cutaneous circulation. If you want to dissipate heat, you dilate the cutaneous circulation. Now, the last two in the systemic circuit we're going to consider will be the renal and splanchnic circulations. Now, most of this will apply to the renal circulation, so we're more interested in the renal response here. Now, the first point is, under normal conditions, the renal and the splanchnic circulations do exhibit strong autoregulation. And many people do teach that under normal conditions, the kidney exhibits strong autoregulation, and this is correct. Therefore, then, if your blood pressure increases slightly, the renal circulation will constrict. If your blood pressure decreases slightly, the renal circulation will dilate in order to maintain flow. However, in emergency situations, you always get a strong sympathetic response and the kidney will constrict. So under emergency conditions then, you always seem to get a vasoconstriction of the renal circuit. Now, just to make sure there's no misunderstanding here, then, if your blood pressure starts to decline, the initial response in the kidney is a vasodilation because it wants to maintain flow. But as your pressure decreases more dramatically, what you get is a vasoconstriction and the kidney tends to shut down. In these emergency situations, the body is more concerned about perfusing the brain and the heart tissue. So it sacrifices renal perfusion for the brain and heart tissue.